All right, good. Hey everyone, my name is Timothy Harris, and today I'm here at Mayo Clinic's campus in Jacksonville with Dr. Nancy Dawson. Dr. Dawson is an internal medicine doctor with multiple Teacher of the Year awards. So Dr. Dawson, I've already introduced you a little bit, but I'd like to ask, who are you and what do you do?
You're right, I'm an internal medicine doctor, but I do and have been many things at Mayo Clinic. I work only in the hospital, so I'm an internal medicine hospitalist, but I'm also an associate program director for the internal medicine residency. So when I'm in the hospital with a team of residents. So I spend my time taking care of patients with residents, teaching and education in medicine, because I love education and I love teaching. So I do that in my career in medicine. But I've also held many leadership roles, and I currently am the medical director for quality data and analysis for Mayo Clinic. Quality improvement is one of my loves, one of the things I love to do, and one of the things I've spent a lot of my career in and a lot of my research actually.
Can you elaborate more on the concept of quality improvement?
Yes. So in healthcare, most people know about a report that was back in 2001 called To Err is Human, and it was talking about the number of errors in medicine that really started to change the way we look at our healthcare system, knowing that all healthcare systems can improve and can improve patient care. And particularly here in our institution at Mayo Clinic, we highly value continual quality improvement. Continual improvement, whether it has to do with patient care, whether it has to do the way we make our schedules or the way we do some kind of administrative work. One of the things that we take a lot of pride in here is that idea that we can always be better, and we can always take care of patients better. So we have a very large presence in quality improvement at Mayo. We have something called a Quality Academy, and everyone at Mayo can earn a certain level of expertise in doing quality improvement with proven methods, with practicing, with doing projects, all that kind of thing. Anyone can learn that. We have classes, we have, you take a test, you're bronze certified, gold certified, bronze, silver, gold, and then there's a diamond award. But that's what I've spent a lot of my career here. I've written the quality, I think that's. So anyway, we do a lot of quality improvement. I've written a curriculum to teach it to residents. And so all of our residents do quality improvement projects every year too. It's fun. When I take care of a patient and I see the improvement in that patient, and that's very satisfying. When we do quality improvement, we see the effect on thousands of patients. We fix a process that makes our patient care better. You get to see the effect of that on thousands of patients, and that is really a satisfying feeling.
So tell me about your childhood and how you found yourself working at Mayo Clinic.
Okay. So I've always been interested in sciences, in math. Math was always a big thing of mine I enjoy doing. I come from a family of engineers. My father's an engineer, both my brothers are engineers. My sister's a financial analyst, so we've all been in the sciences pretty much. And but when I first went to college, early in my life, I was actually an accountant. And part of that was because I met my husband in college and he wanted to do business. And so he was the one who encouraged me to do accounting, and we did have some businesses. But I always wanted to go back to school. And so when our children I have an interesting path to medicine that you'll hear now. It's different than most people. So when we have 3 children, and when our children were in grade school, I remember saying to my husband, I think I want to go back to school. I want to do what I need to do to get my CPA, because I didn't have a CPA. And he said to me, you have a lot of years to work left. If you could do anything you want to do, what would you do? And that's my husband. He's really an encourager like that. And I said, well, I'd probably go back to what I originally wanted to do, which is medicine. So he said, well, why don't you try it? What's holding you back? I thought, okay, I'm going to apply one time to medical school. And if I don't get in, I'm going back to school and get my CPA. And I applied to medical school and I got in. So I was what they call an alternative student. That means later in life. I went to medical school. There were a lot of advantages to going to medical school at my age because, like, I was in my 30s, because I had a stable family. I didn't have to go out and try to find a social life. I already had my children. I had 3 children. I knew I wasn't going to have more. And I had a very supportive family, and I kind of had life experience in which to put some of these things. And so I felt like I had a lot of advantages going back at that time. So then I did my residency here at Mayo Clinic, and I was very fortunate to have the opportunity to stay on as a staff member. So at the time I graduated from residency, I did 1 extra year as a 1-year fellowship in general medicine, and got the opportunity to stay on. And so I've been at Mayo Clinic ever since then.
So how was going to medical school and having 3 kids at the same time?
It was actually easier than going to medical school and getting pregnant and having a baby. Because my kids, my youngest was starting grade school, so they pretty much knew how to take care of themselves. Obviously they need help too, but I was in school, and then I'd come home and be home when they were home, and I had to do a lot of studying, but a lot of studying I was around my own house. Very stable family, and my kids have always been very proud of what I did. So I feel like that was easier than having to start a family and start a new relationship. Mine was already stable.
Who is one person that inspired you to pursue your interest in science?
Well, my interest in science probably would be both my parents, because they were very focused on education, very strong. They really felt like both of my parents were the first to graduate from college in their families, and so they really felt like education was very, very important. And there was never a question in my family growing up that we wouldn't all go to college. That was just a given. We're all going to go to college. I guess my interest in science was just always there innately. I was just always interested in science and math, and always did well in science and math, so that was something I always loved. And nobody else in my family is a physician. Nobody else is in healthcare. That was just my own interest. But I do credit my husband for really encouraging me to pursue medicine. And I cannot imagine doing anything else. I love what I do. I just love what I do, and I'm so grateful to be able to do for my job something I love doing so much in an organization that I love working in. So it's a dream.
So how did you land up working in the field of internal medicine?
You can choose when you go to medical school to go the surgical or the non-surgical route. I knew all along I was never going to be a surgeon. I find surgery very boring, actually. It's just a lot of handwork, and you're standing there in the OR for 8 hours doing things with your hands. That's not what I wanted. I wanted something that was going to be more of a thinking kind of specialty. So I knew I'd never go into surgery. So if you don't go into surgery, you either go into internal medicine or something like neurology or dermatology. But internal medicine is the most broad, and I love variety. So I always knew that I would stay in some type of internal medicine, just general internal medicine, and I never thought I would do a fellowship because I really like variety. So I like seeing something different every day, which is what I get to see in the hospital.
Next question. What qualities do you believe make a great doctor?
Obviously, you have to have empathy, and you have to be able to empathize with your patients. But to me, the best doctors are the ones who know what they don't know, because you can never know anything. And if you recognize, I may not have the answer to that, because I recognize that all the time, it makes me do a couple things. One is try to find the experts who do know something about that, or look up in the literature. What are the latest studies? What does the evidence show? And I'm always worried when I see particularly a resident who always thinks they know the answer, because then that doesn't spur you on to learn more about whatever it is that you're doing. One of the great things about medicine is they talk about it being lifelong learning, and it really is lifelong learning. When I'm seeing patients, I learn something new every day. It's really fun. So you have to be able to know how to relate to people and empathize, but you also have to recognize that you don't know everything, and you go to colleagues or to the literature to get the answers.
So what is one moment when you realize you knew you made the right career choice? Internal medicine.
So from the day I started, well, actually, when I was in medical school and did internal medicine in medical school, I knew that's the right thing for me. Because I always knew I didn't want to do surgery, and when I did my internal medicine rotations, I knew it was the right thing for me. I have never in my whole career ever thought I should have done this or I should have done that. And I chose early on to do hospital medicine and not outpatient medicine, because outpatient medicine seemed a little tame for me. I like the sicker patients that I see in the hospital. And I've always been grateful that I chose that too, because again, I never know. I never know what I'm going to see behind that door. Every patient's different. So I've always been very happy with my choice.
What was a tough time in your career, and how did it change you for the better?
That's a very good question. So the first tough time was medical school itself, because that was really a conscious choice to go to medical school. And I remember there were times thinking, what was I thinking? Why did I ever think this was a good idea? Because medical school is really hard. Once I got out of medical school, my toughest times have actually been in my leadership roles. So I've been chair of actually 5 different departments or divisions here for various reasons. And the most challenging times are when there's some type of major issue in the group that I'm leading, or something having to do with my leadership role. It can be challenging, either something that one of the people in the department or division are going through, or just a situation. Those can be very challenging because you're dealing with, I can deal with people's health actually. It's that day-to-day work life that can be actually more challenging. I've had to fire people. That's the worst thing you ever have to do, is fire someone. But as a leader, sometimes you have to do that, and sometimes it's not necessarily firing someone from the organization, but kind of firing them from a position that they're doing. And I've had to do that several times, say you can no longer be in that position, and that's very challenging.
What are your future goals in internal medicine or science?
I'm always doing clinical research. I do enjoy research. I lead now at this point in my career, because I've been here a while, I try to help others progress their leadership, and I especially like to help and mentor women in medicine, because having women advance their academic careers can be a challenge. Because no matter what we say about equal roles at home, biologically, women have a stronger role at home by necessity, right? They're the ones that have the children, and in the end, they're the ones that often need to make that decision of, I'm going to go to that school function rather than work on this paper. And men do that too, but again, just by biology, women just have more of a challenge of advancing academically. And so that's a very big interest of mine. I lead a couple groups here at Mayo of female physicians trying to advance their academic career. And so I would like to see more women advance in academics, in their academic career, get to full professor, as well as leadership. We're trying to do that at Mayo, and that's probably one thing that I want to continue to do in my career here. Very happy with the patient care that I have, particularly working with residents. But to help, as I said, I've done a lot of leadership roles here, and I would like to be able to help others attain that job satisfaction of getting to do what they want to do.
What's your favorite type of movie? Horror, comedy, action?
I really do like horror movies, but my favorite genre of both movies and books is mysteries. So I love suspenseful mystery movies, and I love mystery books.
Looks okay.
Yeah.
Where's the best vacation spot that you've been to?
My husband and I travel a lot. We love France because we actually lived in Europe for 2 years early in our time together. So we go back to France quite often. But probably my favorite vacation spot that I've ever been to is Istanbul. That is a very exciting city, and I loved that trip to Istanbul. So that was one of my favorite places to go vacation. Frankly, I like to go someplace different. Every time I go on vacation, I told you I love variety. I like to go someplace different. So if I can find a different place to go every time, that would always be my choice.
What does your daily routine look like?
It's very variable. When I'm on hospital service like I am right now, I round with the residents. It takes us all morning to round on our patients, and then they work on the patients while I had a meeting at 12:30. I'll have a couple meetings because of my other roles here. And then I go back to the residents. If they've got new patients, we talk about those patients and round on those. When I'm not on the service, then I have a fully administrative role. So it's basically meetings, leading in the areas where I'm still have leadership and time. So I vary between administrative roles and clinical roles. I'm 50% each right now. So I'm half of my job here is administration, and that's meetings and working on things to, like I said, quality improvement things and things like that. And then the rest of the time I'm seeing patients, and I'm seeing patient residents. So that's my typical day.
So would you prefer, Dr. Nancy, would you prefer 100% administrative or 100% clinical?
Neither.
Or do you like 50% of it?
I like 50% is the maximum that I should say. That's the minimum I want to give up clinically. I mean, I became a doctor to be a doctor, not to be an administrator. But I do like, as I said, I like variety. So I never want to be less than 50% clinical. But I would not want to be 100% clinical. Early in my career, of course, I was 100% clinical, but I like doing other things. And so helping out with so at Mayo is a different kind of institution because all of our leadership roles are physicians. So we're a physician-led organization. So our CEO's a physician. All of our major leadership roles are physicians. So there's a lot of opportunity to be in leadership at Mayo in a lot of varied ways. And so for many, many years, I've held one leadership position or another. And I do enjoy that. I do enjoy having some influence over how we deliver healthcare at Mayo. And so I like that combination of administration and clinical work, but I would never want to be less than 50% clinical. That's the other thing that's unique about Mayo. Even though all of our physicians, all of our leadership roles are physicians or are physician-led, all of our leaders still see patients. Because it's really important to keep that in the forefront of every decision we make. How's that going to affect my patient? And if you're still seeing patients, then you know how that's going to affect your patient. And it helps us to keep that patient in the forefront of everything that we do.
So Dr. Nancy, it seems like you have a mentoring opportunity for residents. So what qualities describe a good resident?
A good resident has an inquiring mind. They should question a lot. They need to be open to feedback. And they need to be very passionate about their own education. So always doing something, always doing things that makes them continue to be a better and better doctor. We're pretty good here at giving our residents opportunities to continue to improve and learn. And I love seeing residents who are inquisitive and always asking questions and always checking their own plan for that patient and then checking with me as the attending about the plan for the patient. But when I say something that they don't, maybe wasn't what they were thinking of doing, they should feel free to challenge me. Okay, why do you want to do that? Why is this not good? I really love it when a resident is very, very inquisitive. That's how they learn. So those are...
What do you see in the future for internal medicine within the next 50 to 100 years?
So I would say internal medicine would be similar to all of medicine. First of all, the advances that are being made now in treatments, there's so many more targeted treatments for things, both for cancers as well as inflammatory diseases like rheumatoid arthritis and inflammatory bowel disease, and some of those that we didn't have a lot of treatments for before, but now we have some really targeted treatments for these diseases that are having a huge effect, making people have much better quality of life when they have these diseases. That's very exciting to me as an internal medicine physician, to be able to offer treatments for patients that we never had before. On the other side of things, technology is really influencing how we practice medicine, and in a lot of good ways. Some ways are annoying, like we have this electronic medical record that doesn't always feel like it's saving us time. However, we're doing more and more things by putting what we call like an AI algorithm in the electronic medical record to help us help our patients. So a really good example is right now we're creating an algorithm for our physical therapists to be able to prioritize which is patients they need to see first. So which is the patient that today would most benefit from having a physical therapist, because all of our resources are limited in medicine. So if we can use certain criteria that we can run on these patients, say, oh, this patient would really benefit from physical therapy today, and so that's the first patient we're going to go see. It saves time. It makes the patients that really need our physical therapists get them. And we're doing more and more of that. I'm seeing that we can automate a lot of these decisions we used to have to make, on our own, or you're making on paper. It's allowing us to become more efficient. So using technology to help, there's always going to be a need for an internal medicine doctor that takes a look at a patient, because unfortunately our patients don't read the medical books. So they don't always come with the exact symptoms that you expect to have happen in a particular disease. You can't use a computer for everything. You got to look at the patient. But there are a lot of things that we were doing by hand that can be taken over by technology, and that allows us hopefully to spend more time with the patient, or to be more accurate the first time, rather than have to try this and try that, but be more accurate the first time. So I think that's very exciting, both the targeted treatments that we're seeing now more and more, and the way technology can help us be more efficient and more accurate in the way we take care of our patients.
What does it take to be Dr. Nancy?
You know what? I think anyone, just about anyone, can be. Obviously, some people enjoy. My husband could never be a doctor because he can't stand the sight of blood. So not everybody can be or wants to be a doctor. But I do feel like, I took a different path to medicine, and there are lots of pathways there. I feel like anyone, if that's what you want to do, that's what you should pursue, whether it's right out of college or 5 years out of college or later in life like I did. It's never too late to do something that you feel like would become satisfying to you. So I don't think I may be a little bit unique in that way, but I do think that that anyone can take the time to pursue something that's going to make them feel satisfied in life. I'm grateful that for me that's my job. Not everybody gets to just love their job like I do.
What is the most challenging part of your job on a daily basis?
The most challenging part of my job is, that's very easy to answer, is that 30-year-old patient who has metastatic cancer. I see patients all the time who are struggling and who I know, I can't tell you how many times I said to a patient, if I had a magic pill, I'd be giving it to you. Even though we have better and more targeted treatments, we still take care of people in their most vulnerable time of life, and I don't always have something to help them with. And that can be very challenging, particularly in a young patient. The most I can do is try to help them have the best quality and understand as much as they possibly can what's going on with them. But that can be very difficult. It can be very difficult walking through a very serious illness with particularly a young patient. I didn't do pediatrics on purpose because I don't think I could see children get ill like that. That would be too hard for me. So it's a little bit easier with adults, but I still have very young patients who have very serious diseases, and that's probably the most difficult part.
What would you say is your greatest achievement as an internal medicine doctor so far?
That's probably kind of hard to say because I don't know the greatest one achievement. I'd say that my greatest contribution is what I do in education. So training up the next generation of doctors. I think I'm a pretty good teacher. I know I love doing that, and usually when you love it, you're pretty good at it. And so you'd have to ask my residents, but I do enjoy that, and I think my greatest contribution is what I've been able to give to the continual next generation of residents, because I've been an educator here for many years, and so I've had an influence on a lot of doctors and future doctors. So I think that's my greatest contribution.
So would you say that the sky is the limit?
We all have our limitations. I think we need to know what our limitations are. I think the reason that people get burned out these days is because they've gone beyond their limitations. So I don't know if the sky's the limit. I think if you understand what your own limitations are, push yourself a little bit, but make sure you know what they are so that you keep yourself healthy, both mentally and physically. Then you put on your own limitations. So some limitations are legitimate, some limitations we put on ourselves. So I think as long as we're challenging ourselves and understand our own limitations, that's where we go.
So for the people out there watching the high school students, Dr. Nancy, what advice do you have for the future generation of STEM scientists?
So my advice is that go for what you really love to do, because you're going to be working your entire life. And I can't tell you how wonderful it is to be going to work every day doing something you love doing. And if you choose to be, let's say, a bioengineer, and after 10 years, you decide, I don't think I really enjoy going to work anymore, I want to try this, then do it. I can remember I went to medical school, because I went to medical school at the University of Cincinnati, and that's where the Procter & Gamble headquarters is. And one of the other, what I would call alternative students, so he was in his 30s, was an engineer at Procter & Gamble. He was in my medical class. So I said to him, I remember saying to him, Bruce, why did you decide to go to medical school? And he said, I just got tired of reformulating toothpaste. And I thought, that's a perfect answer. He wanted to do engineering. He did engineering for a while and decided, that's not satisfying me anymore, so I'm going to do X. I'm going to go to medical school. And so I would really encourage high school students, go for what you think you're going to do, but that you really want to do, but know that's not an irrevocable decision. You can always do something different, even if you have to get there gradually. Not everybody has the opportunity like I did to be able to just quit what you're doing and go for it. But I could have done that more gradually if I needed to. So remember that what you're getting yourself ready for, you're going to continue to do, but it's not irrevocable. I've done 2 big things in my life, and I'm grateful to be able to do them.
Well, Dr. Nancy, we appreciate you having us out here. Thank you for the interview.
You're welcome.
That's
It's been
all I
fun.
have. Thank you.
It's been fun.